If you have low back or hip pain or even leakage and you're a runner, or I don't care what kind of athlete or non-athlete you are, it is likely that your hip flexors are short and weak, especially if you're a mom. My name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist and co-founder of the Vagina Docs. And in this video, I'm going to go over an exercise that you could do, 2 exercises that you could do to work on essential hip flexor strength so that you can overcome your pain in your back and your hip flexor and even your leakage. First exercise is going to be one that you are going to be sitting on your butt on the floor. It can be helpful to place a yoga block underneath your butt, especially if your hamstrings are tight. How do you know if your hamstrings are tight? You can't get into this position and be upright. You either have to round your back or bend your knees. I have pretty good hamstring length and pretty good core strength, so I'm going to stay here demonstrating the full expression of the movement. I'm going to line my spine tall. I'm going to gently engage my deep core. So what does that entail? I'm going to gently connect my belly button inward toward my spine, very gently. I'm going to take up the slack of my pelvic floor. If you are confused what either of those things mean, comment below and I'll send you some resources. Then, after I connect, I'm going to lift a straight leg up. I'm going to tap to the left and I'm going to tap back to the center. So from the side, it looks like this. I connect, I tap to the side, I tap to the center. All the while I'm avoiding front and back lean, and I'm keeping my core engaged. I recommend exhaling as you lift, inhaling during your pauses. If there's a little bit of lean, no biggie, but the more upright, the better. Where you're going to feel this is very much through your groin as well as your quad. You want to squeeze your quad muscles to keep your knees straight. That's going to really challenge the quad, so you might feel like it wants to cramp, especially if it's not used to this movement. You do this on both sides. The second exercise is in standing or in sitting. Going over this standing variation, you're going to ground your feet underneath your hips. You're going to shift your weight without leaning onto one leg, finding 3 points of contact through your feet, your big toe, your little toe, and your heel. Squeeze your glute and quad to stabilize your hip and your knee in extension or straight, and you're going to float the hip, the opposite hip up. We could either hold here for 30 seconds or we could do slow, controlled pulses with or without resistance on this leg. As I do this, there is no movement, no lean. I'm super strict, and I'm really just going just above 90 degrees or parallel, just below, and doing little pulses. I typically recommend people do that for bouts of time. You could also do an alternating march, either with your arms forward, arms down, holding something, or arms up. Keep in mind when you do a weight shift, you have to keep in mind, connect, so that you can unweight and you're not falling all over through your spine and not actually falling. It's something we look at in the clinic, like your spine doesn't rotate, but you're actually really stable. That's a great option, or using resistance or no resistance. And again, time intervals. Think about where you want to get to in your run or whatever activity it is. I like 30 second to 60 second intervals, doing 2 to 4 rounds of that. With this exercise, you should feel this in your groin, your hip flexors. You're also going to feel your core balancing out. If you don't feel your core, bring awareness into your core, your deep core, pulling belly button in, connecting to your pelvic floor just gently, and then varying the intensity behind those connections based on where you are now. If you're not sure where you are, reach out to me. Work with people virtually and in person. We also are developing online programs, online workouts for individuals just like you to tackle and be on track without worrying like, am I supposed to be doing this? Am I not? Am I hurting my pelvic floor? Am I not? All of that is in the works. If you have any questions about anything I covered in this video or about any of the programs we offer, comment below, reach out directly. Otherwise, thank you so much for watching, and I'll see you on the next video.